Now, Gary Bond has showed very clearly that it's not supported employment per se, but being in a job that helps people to improve their self-esteem and their lot in life in many ways, in terms of how they learn to manage their mental illness, and in terms of how they think about quality and life satisfaction in their lives. And these gains accrue over time the longer that people stay in competitive employment. And it's very clear that the same gains do not accrue for people who stay in sheltered employment for similar amounts of time, even if they earn similar amounts of money. I sometimes hear professionals say that, well, we might as well put people in the more sheltered kind of jobs where we can watch over them, because we, particularly if we can pay them well, there's really no difference. But the clients somehow perceive a difference. They know that a real job is a real job and a sheltered job is not. The long-term outcomes, which I told you I worried about for many years at the beginning, are really pretty strong. We now have 6 long-term studies, and 4 of them that have followed people for at least 10 years. Every one of these studies, the outcomes improve over time rather than deteriorating over time. And again, that's different from anything else I've ever studied as a mental health intervention. In general, we have to keep giving people medicines, or keep giving them psychotherapy, or keep giving them various kinds of supports, or the effects erode rapidly. But that doesn't seem to be the case in supported employment. It looks more like if you launch people on a trajectory of working, that natural forces take over, and somehow they make connections in the community, and they build their own strength and resilience. And if you come back a few years later, even if they haven't had a lot of services, they're doing better rather than worse. That is, working longer, working more hours. One of the really remarkable things that we just learned, this analysis is not yet written up, but in one of our studies, and this is actually a study of dual diagnosis clients, patients who have serious mental illness and substance abuse problems. And we've been able to follow these people for 15 years prospectively, large cohort of people. And because some of them were in centers that instituted supported employment at the beginning of the dual diagnosis study, the patients from those centers were highly likely to go to work. And so we've had a chance to look at them over time. And you can see in this slide the yellow group are the patients with dual diagnosis. And again, these people were selected not because they were interested in work, but because they were so seriously disturbed. They were in and out of hospitals and jails at the time the study began. But nevertheless, about 4 of them, 1 in 4 of them, or 25%, became good workers. And as you see, they started slowly and really built up to their level, their optimal or modal level of work after about 5 years, and then they maintained that trajectory over time. There was also a group of people who, and these people again went to work because they happened to be in the 2 or 3 centers that were doing supported employment at that time. It's not that they were selected for tremendous vocational interests. Patients in the other centers, you can see there was another quarter of the patients where supported employment came much later in time, and they started working well out into the 7th or 8th year. And then there's a big group of the patients that never worked at all, at least in the first 10 years here. Well, one of the interesting things here is we have detailed cost analyses of what it costs to take care of these people over time. And the average client who goes to work costs the mental health system about $150,000 less than the average client who doesn't go to work. And I know from following these people carefully the reason for that. The people who don't go to work 10 years later are still living lives as though they are dependent chronic mental patients. The people who have gone to work are living their lives pretty independently. A lot of them, some of the ones I take care of, in fact, I see once a year for a medication check, and that they've pretty much moved out of the mental health system, and they have their own apartment, their own car. They're living a totally different kind of life. And when I bring some of them to meetings or show their pictures, people will say, well, those aren't like our patients. Those people don't look really ill. But since I've known them back in the days when they were in and out of hospitals, and I can promise you that they were very ill. So that's my 45 minutes. I appreciate your attention very much. Thank you.